I lead a very active life. I play golf and tennis and do a lot of hiking. And as a result of that activity, I've had a number of injuries that have been treated by Dr. Terry. I've had shoulder injuries and elbow injuries, and probably most recently and dramatic is a knee injury that Dr. Terry has treated. And as a result of her treatment, I've been able to get back and play tennis on a regular basis again.
This is the treatment that I used to treat Roger's knee when he was recovering from his injury, and it's also the same treatment I'm going to be using as a maintenance treatment right now. So if you would please roll up your pant leg. I'm going to be using my probes with my water, and I'm going to be using blue color just as an anti-inflammatory. So you can clearly see there's the blue color on the probes right now. I'm choosing Circle the Dragon as my basic treatment. I've got my Q-tips wet, and I'm just going to be treating the local area around the knee. Again, treating about 3 to 5 times per set of points. That's 6-second treatments. Good. How's that feel?
Good.
Okay, and very simply just treating the whole local area in and around where the point of pain was and where the injury was. It's almost like the face of a clock. Are you having any pain, local pain at all?
No, very little.
Very good. A little bit more water. And I just want to get behind your knee. So I'm going right through the joint. One more time. I'll have you just flex and extend your knee a few times.
That feels good.
Feels good? Okay. So a little bit of movement is very important when you're doing either a local treatment or even a treatment with some pads, as you'll see at another time. So now I'm going to switch my machine. I'm going to do a polarity treatment called dermatomedistal, using positive and negative probes. My trigger probe is now the negative probe, and I'm going to treat from the lumbar spine, about L4, L5, with my positive probe, and my negative probe is going to go down in the area of the injury. You can hear, I don't know if you can see it, but you can hear the change in the meter. We're looking for the meter to rise with this type of treatment, this polarized treatment. And we're doing very well. We're up to about 80%. And now we are at 90%. I'll do that one more time. Now I'm in the area of about gallbladder 34. And we are now at 100% reading. So I'm doing one more. Very good. And let's have you move that again.
It feels terrific.
I've just completed the dermatomedistal treatment. The positive probe was on the lumbar spine. The negative probe was in the area of injury. We had him move his knee, and it's feeling really, really good. I'm just going to seal in the treatment and finish it up with a procedure we call the Great Loops, and that involves going from the area of pain with a positive probe to the opposite side of the body, in this case, left knee to right elbow. So I'm going to palpate around the elbow and find a tender point.
Oh, you were right there the first time.
That was quick. Just found it right there. All right. So I'm going to treat across the body. I'm going to put my positive probe on the point on the knee. My negative probe goes on the opposite side. Is that it? Okay, so it's positive on pain, negative on the opposite side of the body, and we're going to treat again, maybe 3 to 5 times. And we're already getting a great reading. Good, good, good. Do that one more time. And we are already at 100% after just 3 6-second treatments. One more. Excellent. Okay, still feeling good?
Yep, feels great.
This is just an example of how easy it is to do a maintenance treatment. We're going back and recreating some of the things we did on the initial injury. Local treatment with Circle the Dragon, dermatome and distal, positive and negative, and what we call great loops going from area of pain to the opposite joint. Patient is happy?
I'm happy.
Okay.
Like I say, put me back in the game.
We'll see you next month. Thanks.